Welcome back. You are listening to the Mario Mukanda Show on Salam Media. It is 12:32 on this Wednesday, the 21st of October 2020. So, we are going to be talking about sleep apnea, which is one of the most fatal sleeping conditions, with the founder of Arkle Sleep Health, Jan Daniel S., or like he said before, just call me JD. JDS, good day.
Hello, Mariam. How are you? Can you hear me, Mariam?
Yes, I can. How are you today?
I'm well, thank you. It's just a bit hot here in Pretoria, but
Definitely.
otherwise I'm doing fine.
Yeah, I know. I know
Yeah.
exactly what you mean because I live in Pretoria as well. So Pretoria weather is crazy. But
Yeah.
moving on, sleep apnea. What exactly is sleep apnea, and why is it one of the most fatal sleeping conditions?
Sleep apnea is a condition. It also only happens when one is asleep, obviously. When we sleep, we go into certain sleep stages, and when we go into certain sleep stages, we tend to lose muscle tone. We call it atonia. And with
Hmm.
sleep apnea, in those conditions, it is when a person basically stops breathing when they are asleep.
Hmm.
So it is not really directly fatal, but it is a very dangerous disease in that a person can, develop very serious comorbidities like blood pressure problems and sugar problems and carcinomas and cancers and so forth.
Mm. So how does one develop sleep apnea?
It does not really indicated, but it's usually associated with people who have low muscle tone at night, and then also people who are our larger community. It's linked to overweightness, people who are
Yeah.
overweight, and it's also established that about 20% of the people who do suffer from sleep apnea, only 20% gets diagnosed with it. It is currently the second largest sleep illness that we deal with all over the world.
Mm-hmm.
So yeah,
Okay.
so to answer your question, it's basically usually linked to more overweight issues, but it does that is not the sole exclusion factor. Many people can have sleep apnea.
Mm-hmm. All right. Speaking about that, what are the warning signs that we should be aware of?
Um, well, there's quite a lot that we should be aware of. The one most common one is probably snoring. If a person snores, I'm going to miming it now. So you need. So many. What we find is many of the spouses usually complain that my spouse, my bed partner, is snoring, and it may sound like a person is snoring, like okay, and then there's a cessation of breathing, and then all of a sudden the person goes like like a arousal, and that is a typical sign of a apneic event.
Mm-hmm.
So
Right.
snoring is a big issue, and then also in some cases tiredness during the day. We call it excessive daytime sleepiness.
So
Mm.
if you hear your partner
Yeah.
snoring like that,
Yes.
should you wake them up? What should you do?
Yeah, no, usually that's a good question. Many patients complain that they are very tired during the day and that they suffer
Mm.
from a pain on the side of their chest as the spouse bump them. Right. So usually, it's very irritating for the bed partner. You can wake them up and get them to breathe, so that you can, you can wake them up if you want to. Many people don't know they have sleep apnea. um, I just want to go back to your previous question about the other signs. The latest data, scientific data, shows that many patients with type 2 diabetes, and I'm talking more than 50% with type 2 diabetes, have sleep apnea as well, and also hypertensive patients. The chances are
Mm-hmm.
very, very high that those patients have sleep apnea as well.
Mm-hmm. Are there different types of sleep apnea?
Yes, there are mainly three different types.
Mm-hmm.
We call it obstructive sleep apnea, which is the most common one. That's the dangerous one that we deal with. And the other one is called what we call a central apnea, which is where the brain doesn't send a signal to the breathing muscles to breathe properly. And then we have a mixed sleep apnea, which is basically a mixture of the two. In clinical circles, we also talk about the complex sleep apnea, but that is a bit for our clinicians in terms of, when a person is on therapy, we get maybe sometimes get a what we call a complex sleep apnea.
Mhm. Okay, so JD, how common is sleep apnea, and what do we really know about it? Is there enough
Oh, yeah.
information?
Yes, yes. Sleep apnea is the most common sleep disorder in the world. It's not the most prevalent, but it's the most common one. Just after insomnia is, about the same as insomnia, sleeplessness as well. We know quite a lot about it. There's a lot of research, academic research that's been done on it, and it is something that general practitioners need to pay attention to as well. If they see a patient who has the comorbidities like hypertension and type 2 diabetes, patients who struggle to lose weight, it's almost guaranteed that those patients will suffer from sleep apnea as well. So it is. We know a lot about it. There's a lot of information available on it over the internet, and it's quite accurate information.
Mhm. So, can it be treated? Can it be cured, or can it be
Yes,
cured? And if
yes.
so, how?
The curing and the treatment is two separate things. Let me just maybe talk about how we diagnose it. How do we know we have sleep apnea? Um, we There are lots of sleep laboratories in Pretoria and all over the South Africa. There's sleep labs
Mm,
where a patient can go in and sleep overnight, or it can also be done a sleep study. It's been diagnosed in the form of a sleep study where they rig you up and you look like Robocop for the night, and we test certain scenarios and certain perimeters to see how many times a person doesn't breathe during per hour, every hour. And then once that has been diagnosed, we put the patient usually on treatment, and the treatment may include anything from maybe surgery, and also what we call a MAD device. It's mandibular advancement device where a person uses you usually get it at the dentist. They put a plate, a mandibular plate in their jaw, and it's an attempt to pull the lower jaw forward. That is partially successful. However, the golden standard of treating sleep apnea all over the world is called CPAP. It stands for continuous positive airway pressure, and it consists of a little machine that the patient wears with a mask over their nose and face. It's quite comfortable, and then this little machine blows air down the airway. It's not oxygen; it's just air down the airway, and that air acts as a splint to prevent the airway from collapsing. So it's a common disease. It's very well treated. It's very successful, but there's very limited cases that can be absolutely cured. We must compare
mhm.
sleep apnea like bad eyesight. If you can't see properly, you get glasses, and if you don't breathe properly at night when you sleep, then obviously you get a CPAP machine in most cases. So it's
Mhm.
usually chronic.
Wow. So, is there a sleep position that one can adopt to help with sleep apnea?
Um, you know, it depends on the severity of the apnea. Usually, there is if a person don't have to necessarily sleep on their backs, or they can sleep on their sides. But I don't want to give that away as medical treatment. That will not solve the apnea. It may help a person to breathe a bit easier, but we don't use sleep positioning so much as a treatment protocol for treating sleep apnea, unless the person has a very, very mild apnea, where they stop breathing maybe 3 to 5 times per hour. That's a very mild apnea. And that then some positional training may help, but we can't. It's not a treatment protocol in our practice. No.
Mhm. All right, JD, you just mentioned about mild sleep apnea and the breathing times, and so
Mm.
it becomes worse than that.
Yes, the worst I've seen is where a person stops breathing just over 112 times every hour. And we all over the world, yeah. And I'm talking about the obstructive apnea now. The obstructive
Mhm.
apnea is basically our brain sends a signal to our lungs to breathe, but now no air is getting into the lungs. You know, that's the distinction, and it's very common. So we put the severity of apnea or sleep apnea in three categories. The one is I'm going to going to get a bit statistical now, but if you stop breathing less than 5 times per hour, we regard that as normal, but they can also present some other airway breathing conditions. Okay, we're talking about sleep apnea now. If a person stops breathing more than 5 times per hour, up to about 14 times per hour, that is considered a mild apnea. From 14 to 29 times per hour, that's considered a moderate apnea. And anything above 30 times per hour is considered a severe apnea. And based on that severity, we can introduce, along with other indicators, we can introduce the correct type of treatment for the patient. But the best one is by far CPAP therapy.
Mhm.
Yes.
Mhm. Yeah, have there been any deaths recorded due to sleep apnea?
No, not as far as I know. A person won't. Very little people won't suffocate. You can't suffocate when you have sleep apnea during sleep, just because
Mhm.
of the carbon dioxide that's building up in your bloodstream that wakes you up at night. That which I talked about earlier.
Yeah.
So you won't suffocate. However, many people, it has been recorded that many people may get a heart attack during sleep apnea, because this is the critical thing. Sleep apnea um, is a dangerous disease because it doesn't only rob you away from restful sleep. It doesn't only do that. What it also does is that times that you stop breathing, your body is under severe stress. We call it the so-called fight or flight mode. You're literally fighting for your life every couple of times per hour. And that happens during the time of the day where you are supposed to, or the patient is supposed to have restful sleep, where they're supposed to rejuvenate themselves. They're actually fighting for their lives.
Hmm. Oh, well, that
Mm.
has been a very interesting discussion, JD. Please share with us your contact details if anyone would like to know more.
Okay, they can call me on my mobile number. I'll call back if I can't answer. It's 082-560-6872, Miriam. And then my email address is info, at Arkel, it's ARKELSHC.com. And that's also my website address is Arkel. Oh, sorry, my website is ArkelSHC.com, and they can also just look me up on Facebook.
All right, so thank you so much for your time and
Thanks,
knowledge as
Mariam.
well. Have a wonderful day.
Thanks,
Bye bye.
Mariam. We'll speak soon. You too. Bye bye.
That was JD Ace, Jan Daniel Ace, the founder of Arkel Sleep Health, talking about sleep apnea, which is one of the most fatal sleeping conditions, as well as common sleeping conditions after insomnia. It can affect a lot of people, and there are three different types of sleep apnea, but it's not really as fatally as mentioned in the introduction. But if you recognize any warning signs that your partner might have sleep apnea, don't just nudge them and get them feeling a little pain in their side, but wake them up gently and let them know that they need to go for a diagnosis, just to ensure that they don't really have sleep apnea. But because it's so common, it might just be sleep apnea. You can call Jan Daniel Ace on 082-560-6872, or send an email to info at ARKELSHC, that's ARKELSHC.com. You are listening to the Mariam Mukunda Show on Salam Media. We will be right back.